I'd love for you to speak about Metro Health's staffing and physician care and how they're handling the situation and sort of plans that you've made to be more effective in terms of covering and caring for COVID-19.
Yeah, Brian, the health and safety of our patients, number one, and the health and safety of our employees are of utmost importance and the biggest priority. And so we want to be sure that we're supporting our staff through this, both our clinical staff as well as really our non-clinical staff as well. So we've strongly encouraged, going back the last 2 weeks, that anyone who can work from home should. I mean, pretty much mandating it, in fact.
Yeah.
Number two, there are clinical folks like nurses and doctors who can't, obviously, and they embrace that. They want to take care of patients. But we want to make sure that if they are exposed, number one, that we can support them. So we've got some very progressive and innovative ways to do that, including really being very flexible with PTO, giving them more PTO. We've got something called the STIB bank that, again, provides them more time. We've opened up a child care facility that obviously we're operating gratis for their children, really utilizing just the best sort of the distancing we can with that.
Yeah.
We've also had all now clinical staff in the hospital and in the clinics wear masks. Really, the initial guidelines from the CDC, and probably still true now, is that if you've got a patient coming in with respiratory symptoms, we get them into a different area right away, right?
Right.
They have a mask on, and so when the patient has the mask on, that's very effective in terms of preventing spread.
Sure.
But I get the concern from clinical staff. We get it, and so we're making sure that all our clinical staff actually wear masks now throughout the hospital, throughout the clinics. In terms of our clinics, our outpatients, we've got 18 sites all around the community. What we've decided to do is to not only obviously protect patients, but also protect our providers. So we have 3 of those 18 sites that will see patients who are coming in with illnesses. We've got a hotline that patients can access that will direct them to the ED perhaps, or one of these 3 sites. But the vast majority of our outpatient visits, seeing physicians and APPs, will be done through digital, virtual.
Yeah.
So we were going to do a big launch of our digital platform this summer, our app and everything. We've actually accelerated that.
Sure.
So within the next week to 10 days, that'll be rolled out so that all Metro patients and community patients can access appointments through digital.
This Full Exposure Podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.